I'm Jim Hooten. I'm a physician in orthopedics at Colonial Clinic. I tend to specialize in hip and knee replacement, having completed a fellowship, and so that's my primary interest. One of the reasons that I chose to specialize in joint replacement or joint reconstruction was actually seeing the difference you can make, that very obvious change when a person comes in and arthritis has essentially robbed them of their quality of life and is keeping them from doing the things that they enjoy doing or want to do, sometimes even preventing them from the things that they need to do. And to see the difference when they come back after surgery with a smile, with a tremendous weight lifted from them, and being able to return to those things that they enjoy, that really makes life worth living. That's one of the rewarding things about what I do in orthopedics. In taking care of folks, it's working as a team, and that team includes not only the nurses, the physical therapists, the other specialists, and myself, but the patient's a very important part of that team, and making sure that they know what's going on, they know what to anticipate. And I really believe that a very important part of what I do is not just what I do in the operating room or what I do in terms of trying to manage care or post-operative care. It's also teaching the patient, giving them the knowledge of what's going on with their body so that they can make good decisions. Because I really believe that if you believe that knowledge is power, if I can empower the patients to really have an impact on their health, not just in the here and now, but in years to come, I think that's a very, very important part.